Hello everyone, my name is Lauren Flores and I am a student in the GPH 732 Community Assessment course. This is my fourth semester here at the University of New England and I can't wait to delve into the concepts covered within this course. A little background about myself. I recently moved to San Diego, California last year, where I currently reside with my boyfriend. Previously I lived in Sacramento, California, where I received my Bachelor's of Arts degree in Sociology. I work for a local Women, Infants, and Children, or WIC agency, here in San Diego as a local vendor liaison and project coordinator. As a local vendor liaison at WIC, I provide authorized WIC vendors with statewide WIC information and changes, and conduct surveys on behalf of the California Department of Public Health. I also manage any complaints issued by the vendors or participants. As a project coordinator, I also take part in staff training surrounding the topics of conflict of interest and confidentiality, assist in the publishing of social media posts, and help coordinate outreach and other community events for our agency. Prior to working as a local vendor liaison and project coordinator, I worked as a nutrition service assistant in one of the WIC clinics. Here I learned so much about nutrition, health education, and one subject that extremely interested me, the benefits of breastfeeding. While working within the clinics, I noticed that a lot of mothers with new babies did not always breastfeed and instead would supplement with formula. Formula is not human milk and can have a lot of negative consequences on the development of the child. Some hazards of low-income mothers not breastfeeding their babies include a higher risk of obesity, higher risk of cancer, higher risk of cardiovascular disease, higher risk of SIDS and infant mortality, asthma, and type 1 diabetes. After doing more research on the topic of breastfeeding in California, I found that currently there is no standard of care within the California hospital system to support breastfeeding. Being familiarized with the importance of breastfeeding and the various community breastfeeding resources in the community, I found that there is a deficit in these resources, especially when it comes to resources for those who are low-income breastfeeding mothers. A needs assessment in San Diego County is necessary in order to further lactation education, breastfeeding programs, and support systems. I have very little experience in conducting a community health needs assessment. While in my undergrad, however, I did have some experience conducting surveys for the Behavioral Risk Factor Surveillance System survey, led by the California Department of Public Health and the Centers for Disease Control. BRFSS is a telephone survey that collects data regarding participants' health-related risk behaviors, chronic health conditions, and use of preventative services. The population covered in the BRFSS survey was solely California residents. The community needs assessment project that I will be completing will include a much smaller population. Low-income, pregnant, postpartum, and breastfeeding mothers in San Diego County will be my focus population. 2 places within the community that I will complete my final project include 2 different WIC clinics, one in Claremont and the other in Mira Mesa, which are both small communities within the county of San Diego. These locations are perfect because they both work directly with low-income families and would be great sources of participation for the community diagnosis to be conducted for this final project. At the end of this community diagnosis, I hope to address the local health needs of having increased lactation education, breastfeeding programs, and breastfeeding support systems for the 2 communities here located in San Diego County. Thank you, and good luck to everyone who's in the course.